Hi, welcome to COVID classes. This is COVID class 3, and in the COVID class today we will be studying about coronavirus infection. So first of all, what is coronavirus? Coronavirus is a RNA virus with a single stranded RNA and a diameter of around 100 to 160 nanometer. It is enveloped with clubbed shaped projection coming out of the envelope. It is divided into four genera, and the coronavirus infecting humans belongs to two genera, that is alpha coronavirus and beta coronavirus. The SARS, MERS and COVID-19, they belong to beta coronavirus, and in general it is difficult to cultivate coronavirus, and exceptions are SARS, MERS and COVID-19, which we can cultivate in African green monkey kidney cell E6 culture. And if we talk about the epidemiology of coronavirus infection, it is present throughout the world, and it is responsible for 10 to 35% of common cold. The human coronavirus 229E and OC43 are the two strains which are responsible for common cold, and the seroprevalence studies indicate that antibodies are acquired to these strains early in life, and in adults more than 80% of the adult population, they have antibody against these coronaviruses. And if we talk about the reservoir appears to be horseshoe bat and a semi-domestic animal called palm civet. And human to human transmission is very important mode of transmission. Case fatality rate varied among various outbreaks of coronavirus infection, with overall it can be as high as 9.5%, and it was less severe among children. And mechanism of infection transmission is still incompletely understood, and the transmission spread can be from both large and small droplet aerosols, and perhaps by fecal-oral route also. Environment sources such as the sewage or water may play a role in transmission, and most infection resulted in transmission to one or fewer individual, but some of the ill individual, they appear to be having hyperinfection, so they are hyperinfectious and are capable of transmitting to more than even 40 individuals, and they are known as super spreaders. If we talk about the pathogenesis, the coronavirus that cause the common cold infect the ciliated epithelial cell in the nasopharynx via aminopeptidase N receptors or sialic acid receptors. SARS coronavirus infect cells of the respiratory tract via the angiotensin converting enzyme 2 receptors, and it results in systemic illness. And in the systemic illness, virus can be found in blood, in urine, in stool for even around 2 months, and virus persists in the respiratory tract for 2 to 3 weeks, and the titer peak after around 10 days after the onset of systemic illness. The pulmonary pathology consists of hyaline membrane formation and desquamation of pneumocyte in the alveolar spaces and interstitial infiltrate made up of lymphocyte and mononuclear cell, and giant cells may also be seen. And let us now talk about the clinical manifestation. It is having an incubation period of around 2 to 7 days with range of 1 to 14 days, after which there is a start of systemic illness with fever, malaise, headache, myalgia, followed in 1 to 2 days by a non-productive cough and often dyspnea. Approximately 25% of the patients have diarrhea also. And let us now talk about the chest X-ray finding. Chest X-ray may show variety of infiltrates, including the patchy area of consolidation, most frequently in the peripheral and the lower lung field, or interstitial infiltrates, which can progress to diffuse involvement. And cases, in severe cases, the respiratory function may worsen during the second week of illness. So, second week of illness is critical in severely symptomatic individual, and it progresses to respiratory distress and often multi-organ dysfunction. Risk factors for the severe disease include age more than 50 years, cardiovascular disease, diabetes, hepatitis. Illness may be severe in pregnant women, and it is milder in children and adults. Laboratory findings include lymphopenia, seen in around 50% cases, and it mostly affects CD4 T cells and also involves CD8 T cells and NK cells. Total leukocyte count is usually normal or slightly low. Thrombocytopenia may develop. Aminotransferases may increase. Creatine kinase may be elevated. Lactate dehydrogenase may be elevated, and the diagnosis can be made by rapid diagnostic test with RT-PCR of the respiratory tract samples and plasma early in the course of illness, and of the urine and stool in the later stage. And it can be grown, the cultures of the virus, they can be grown on African green monkey kidney cells. Let us now talk about the treatment. If we talk about the treatment, still no specific treatment is available. The supportive care to maintain the pulmonary and the other functions remains the mainstay of the therapy. Antiviral have little, if any, activity against the coronavirus infection. Remdesivir, lopinavir and ritonavir, they have been used in treatment of COVID-19, but still no conclusive studies are there to support if they are effective. Then benefit of glucocorticoids are still not very well established. Hydroxychloroquine has also been used in COVID-19 infection, but still there are not that much studies to support the role of hydroxychloroquine in the treatment of COVID-19. IL-6 inhibitors have also been used, and convalescent plasma therapy has also been used. And Now it is better to prevent the infection rather than treatment. So let us talk about the prevention. Strict infection control practices are needed to prevent infection, to prevent the airborne and droplet and contact transmission from any suspected cases. Healthcare workers should wear gowns, gloves, eye and respiratory protective equipments. And for the prevention, a vaccine is also in trial, but still a proven working vaccine has not been developed and still it is in trial. So this was all about the coronavirus infection, and this is it for today's COVID class.